a lot of clients you'll talk to assume that Medicare will pay for the nursing home. And that will sometimes be their objection for not doing a private insurance program for it. Well, no, two doors down from me, I have a neighbor who spent a couple months in the nursing home and Medicare paid every penny. And that's entirely possible, but it's really difficult to qualify for. So Medicare's involvement is through Medicare Part A. And there are provisions in there to participate in skilled nursing care. And we'll get into those definitions in a moment. So if someone's been in the hospital for at least 3 days, and Medicare doesn't allow folks to stay very long in the hospital, they move them out very quickly. But the patient may still be in need of some rehab type services and some care before they're able to send them home. But the prognosis is, we think that'll happen. So in that case, Medicare will participate for 100 days per benefit period, or per episode, you could call it. 20 days with no copay at all. And then up to another 80 days, so out to 100 days with a per day copay. And occasionally the Medicare supplement, some of those plans could pay for that deductible as well. But that may be what the neighbor's experience was, they had major surgery, they spent 3 days in the hospital, and then the next 6 or 8 weeks in skilled nursing care. And that's why the neighbor thinks, oh yeah, it's all covered. And then when one runs out of money and can no longer self-pay or doesn't have the insurance, then Medicaid can step in and pay. So those are our choices: the government, or self-pay, or long-term care insurance. But you may have already encountered clients that think that Medicare is going to pay for all that. Medicare does not pay at all for custodial care. And most of the care that's received in nursing facilities is not skilled care. It's either intermediate or it is custodial care. And in real big letters in the Medicare and You booklets, it just says several times, Medicare does not pay for long-term custodial care. So here's those levels of care. So the most acute, the most intensive care is skilled care. And that is medically required. Think of it as doctor and nurse provided care. It's on 24-hour oversight, so they're needing this care on a daily basis and only is ever provided by a licensed medical provider. That's the piece that perhaps for 100 days Medicare may participate in. 20 days, no copay; 80 days, a sizable copay. The next level is similar to skilled care. It's called intermediate. And that is, again, medically required care provided by typically nurses or aides under the nurse. It's all under the direction of a licensed physician. But what is different here is it may not be every single day that they need the more skilled part of the care. And then the lowest stage is custodial, and that's what is mostly going on in nursing facilities. These are a lot of you just help with activities of daily living, right? They're not medical services. They're on an as-needed basis, and there doesn't have to be administered by a nurse or LPN or a doctor. A lot of other kinds of aides that are very good at what they do provide this type of custodial care. So those are the 3 levels you'll see in Medicare information, the reference to skilled nursing care only, and the qualifications to get there. I don't recall if I have this coming up in a slide, so I'll just say it. For Medicare, they need to be in for 3 days with a prognosis of improvement. And they have to be admitted to the nursing home for the reasons that they were in the hospital. And that's the only way that that Medicare is going to participate with that skilled nursing care.